Thank you, everybody, and good afternoon. Thank you for the opportunity to speak to you. Just perhaps to give a few points of introduction concerning the Sheffield City Region. Sheffield City Region is in the industrial heartland of the United Kingdom with a population of 2.1 million, 65,000 businesses and an annual GVA of £35 billion sterling. Historically, it was the centre of steel manufacturing, coal mining and heavy industry. It is now the centre of advanced manufacturing in materials and engineering, is leading research and development in advanced manufacturing processes, advanced construction processes, and in research into nuclear and hydrogen energy. In considering the question of the impact on the region of COVID-19, it is extremely difficult to unpack and focus simply on one impact for all the reasons that other contributors have already stated. Of course, there are material, measurable, and predictable factors associated with the impact on GVA, on business survival, on employment, and on the depth of the recession we face. But critically, we also face many new and less easily definable factors associated with the impact on people's behaviour, their working and travelling practices, new ways of living, shopping and enjoying leisure time. We don't know the long-term impacts on people's behaviour of safe distancing, lockdown, and absence from office and urban centres. But we can conclude, as others already have said earlier on, that it will be different from the now. It is in this context of a different world that will emerge that we face the challenges of supporting and sustaining businesses, principally manufacturing, construction and engineering, small and medium enterprises, in also focusing on the support of those economically active who are in or out of work as a consequence of COVID-19, and in helping to rejuvenate our cities, towns and rural communities affected economically, socially and environmentally. With reference to the second slide, I've identified three of the main challenges that we face. Firstly, unemployment. As an economy that's transitioning from traditional heavy industries to modern advanced manufacturing and engineering, we are at high risk of substantial growth in unemployment with all the attendant social and health problems which come with sustained unemployment. Our experience of the global recession in 2007-2008 is that the economic and social shock experienced in my region was deeper and longer than the richer regions of the UK, which tend to be dominated by financial and professional services. Our expectation is that unemployment will double in our region. But just as importantly as the absolute numbers of unemployed is the likely spread of that adverse effect on people. We are particularly concerned that the impact of unemployment will be much greater on certain groups who are least able to mitigate the effects of unemployment. Those predominantly women who are engaged in low paid and insecure employment, young people, and those involved in employer-led training and education are particularly vulnerable to the impacts of COVID-19 on the economy. The second challenge is widening inequalities. My city region is the lowest productive city region in England, and there are vast inequalities compared with other areas of the UK and the national average. For example, average earnings in the Sheffield City Region are around 20% lower compared to the national average. In an economic crisis, inequality often widens the challenges and opportunities that come with the economy growing. The disparities will widen within our city region, we believe, and between our region and others. And this brings with it greater economic burdens and challenges and greater risk of breakdown in social cohesion as a consequence. And finally, the third challenge is in the nature of the recovery itself. For all the reasons I cited in the earlier part of my presentation, it is unknown how the recovery will play out. And our main challenge is trying to predict and plan for different scenarios in the recovery. The Office for Budget Responsibility, which is the UK government's independent economic analysis, predicts a sharp recovery, but second waves of COVID-19, economic challenges in other parts of the world, and indeed structural changes could change the nature of our economic recovery and lead to a different scenario and different challenges for my region. I haven't chosen to focus on one initiative or one mechanism that I believe would be required. I consider that a number of measures blended together to address the key issues around business activity, business survivability, employment and social cohesion will be required in order to recover optimally in a new environment that we're yet to understand in all its forms. However, I do believe that above and beyond proposed economic initiatives, the most important factor is the collaborative leadership which will be required between the anchor institutions within our region, local government, higher and further education, health, the private sector and so on. The key collaboration between our region and our national government so that our recovery planning is integrated and blends national drive for change and improvement with the nuances of what needs to be delivered locally at a regional level. And indeed, international collaboration to bring together the forces across our nations and across our regions to work together in the interests of the economic and social well-being of all our citizens. Thank you.